Good day everyone, my name is Dr. Kenneth Uben from Vet Haven Animal Services, and in this video I'll be talking about a common disease that affects dogs known as canine parvoviral enteritis, commonly known as Parvo. So it is caused by a virus, canine parvovirus, and what the virus does is attacks rapidly dividing cells, that is the cells of the intestinal lumen and then hematopoietic cells that are responsible for the immune system of the dog. So it affects the immune system, and then secondary bacteria and protozoa infection comes like vomiting, diarrhea, dehydration and the likes. So basically the virus itself does not kill the dog, it is the secondary infection that kills the dog. It's like having a country where all the armed forces have been annihilated. The common man will become a criminal because there's no law and there's no order. So that's basically what the virus does. It comes and it wipes out the armed forces of the dog, and then bacteria and protozoa that are not supposed to be infectious now start causing disease. Some breeds are predisposed to this disease, such as the Doberman, the Rottweiler, American Bully, and then German Shepherds. They are usually very predisposed to come down with parvovirus enteritis. It's a disease of young dogs, unvaccinated dogs, and dogs with incomplete vaccination. Other predisposing factors like stress, like change in weather condition, movement of the dogs, and other stressors. Other intestinal parasites like helminths and the likes, infections like Gardiasis, Salmonellosis, Campylobacteriosis, and then even coronavirus predispose the dog to this infection. The mode of infection is fecal-oral contact or fecal-nasal. So the dog has to come in contact with the feces directly from the dog or from termites, maybe somebody that carried the virus to where the dog is at. So it's either direct or indirect contact. I said earlier, the clinical signs for this disease are vomiting, diarrhea, dehydration, depression, and fever. Those are the common signs of the disease. The diarrhea might be hemorrhagic, non-hemorrhagic. Same thing with the vomiting. The vomiting might be hemorrhagic or non-hemorrhagic. But whenever you see that projectile diarrhea, you see vomiting, and then usually there's this characteristic Parvo smell you perceive when you perceive the diarrhea, or when you come close to where the diarrhea is at. You have this pungent odor and it will make you want to even throw up. So, but it is not a pathognomonic sign, because there are other diseases that have that smell. But most times when you perceive that smell, you should be thinking of parvovirus enteritis. Diagnosis is by, of course, history, and then signalement, and then there are some rapid test kits too that are available. You can just take the test, and then by the number of stripes you see on the test kit, it will tell you, okay, that this dog has Parvo. The treatment for this disease, I've divided into 4 for easy understanding. There's the flu therapy, antibiotic therapy, supportive and symptomatic therapy. So the flu therapy has to do with energy replacement and the electrolyte replacement. Some other people add some certain antibiotics in the fluid. Then the antibiotic therapy, we use antibiotics that are indicated for gastrointestinal infections. Then for supportive therapy, we use drugs that would support the dog, aid the dog's recovery process. Like we can give blood, other antioxidants that will boost the immune system. Like I said earlier, the immune system is down, so we need drugs that would boost the immune system of the dog. Then symptomatic treatment. Oh, the dog is vomiting, you have to give an antiemetic. Oh, the dog has diarrhea, you have to give an anti-diarrhea. Oh, the dog has high fever, you have to give an anti-inflammatory, antipyretic, and analgesic. And then, oh, the dog has not been eating, so you have to give an appetizer. So basically they're into 4: flu therapy, antibiotic therapy, symptomatic treatment, and supportive treatment. So Once you can cover the 4 parts of the treatment, there is high chance of recovery. Finally, prevention. Like I always say, prevention is better than cure. Parvo is treatable, but it is better to prevent the disease. Now, this is where a lot of people get it wrong. It is prevented by vaccination and reducing contact with the disease. If you have a dog below 6 months of age, you should do all you can to reduce the contact of that dog to this virus. That is one. Then vaccination, it is between 6 to 8 weeks of age. 6 weeks if the dam has not been vaccinated, but 8 weeks if the dam had been vaccinated that year. So if the dam's vaccination is up to date, you can start at 8 weeks because of the maternal antibody that the dam would pass on to the puppies. And usually I would advise you do your vaccination 4 weeks apart. A lot of people will say 2 weeks apart, but I personally would go for your 4 weeks apart vaccination, 3 to 4 weeks apart. It gives the best results in the sense that when antibodies are waning, that's when you reintroduce the antigen, that's the vaccine. Not when antibodies at its peak, reintroduce the antigen, and then you now have an antigen antibody complex or immune complex. So it starts at 6 to 8 weeks, and you do 10 to 12 weeks, and then 14 to 16 weeks. Thank you so much for listening. Dr. Kenneth Oben from Vet Haven Animal Services signing out.